So hopefully are you guys okay? We'll record it so then others can actually will share with others if they're not here and they can't come. Because I actually had a hard time coming in. The Zoom didn't let me in. So it, it is funny that it didn't, but it is what it is, right? All right. So we are going to start pretty soon. And so Hannah, where are you?
I'm in the Bay Area in California.
Okay, all right. Hi Josh. I can't see you, but hello. How are you?
I'm well, thank you. How you guys doing?
Good, nice to meet you.
Nice to meet you as well. I'm trying to figure out how to get the camera on.
Oh, so I know today everybody's been having an issue. We have a bunch of people that signed up. I don't know if they're gonna come in or not, but that's why we're recording it because we'll send it to them after.
All right. There we go.
How are you? Where are you?
I am in my office in Rockville, Maryland. East.
Oh, okay.
And hi, Jen.
All
We're
right,
doing
go. Yes, I'll do one more minute and then we're gonna get started. So you guys all, some of you know, at consultants, any area specific or anything that you guys want us to focus in specific? It's a conversation. I'll go through the slides really quickly so we have some time to talk. But we actually deal with a lot of families and patients that have a personality disorder, and so we realize that anytime you guys call us and you're panicking is because that is happening. Some difficulties with that. So is that something you experience in your practice? A lot, right?
So I'm actually a psychologist, so I have a therapy practice as well as placement consultation. And if you can touch on, so I don't do therapy with people that I place, and I don't place people I do therapy with.
Sure.
Um, if you can touch on ways to navigate when the therapist should be coming out, when the consultant should be coming out.
That's a great question. Definitely, definitely. Hi, Missy. Hi, Christine.
Thank you.
Hi, Christy. Welcome, guys. I'm gonna get started. We have more people coming, but there's a little bit of a technical difficulty. Hi, Missy. How are you? I think some of you know each other for sure, right? Nice, sweet community. Missy, where are you so everybody knows?
I'm in Raleigh, North Carolina.
Okay, all right. Christy, I don't know if you could see us. We can't see, but we can probably hear you.
Oh, you can't see me. I'm sorry. Yeah, I am in Rehoboth, or not Rehoboth. Oh my goodness. I'm in Fenwick Island, Delaware.
Oh, in Delaware. That's awesome. Great, great, great. All right. Oh, Dee Dee, you're here. How are you?
Oh, good. How are you?
Good. Thanks for coming. I appreciate it. If you want to share your image, you can. All friends, anybody, pajamas is okay. No makeup, like anything is good. So this is our second round of MBI clinicals. Dr. David Tolan did the last one because it was on exposure without Be Lovely. He works with us about 60 hours a month in supervision with our team to elevate our team, even, teach them, really develop their skills. And so we thought that he would be awesome since he wrote all the books on exposure. We thought, why not, right? So that was really fun. I don't know if you missed it, let us know. We can send you the recording. And so our goal is to create a space where we can actually, with our consultant friends, sit down and have conversations that are clinical. We're not expecting any referrals from it. It's just a question of like talking about cases, learning from you, and getting together and helping each other in caring for patients, which is a really big job that we do. And we don't give ourselves credit for how hard it is. We've John Hoffman. Do you want to introduce yourself, John?
Yeah. John Hoffman, along with Katya, we founded NBI and NBI Ranch and the various other things that we do, and are the clinical directors of all the programs and services. And I'm excited to hear, Katya is a great expert in this area and in terms of working with families. And I'll chime in as needed, but I'm here also to the spirit of collaboration and to meet everybody. And we know we have all these common dilemmas, and I'll just say from the outset before Dr. Ritz starts is that it's interesting when you think about personality disorders, and the question maybe will come to at a certain point are these acquired personality disorders? Because having a kid with certain issues can certainly make you seem very personality disorder, and it goes the other way. Having parents of a certain way can make a kid seem a certain way, and maybe it's a combination. And so it's such an interesting area to discuss. So without further ado, Katya, take it away.
Absolutely. So yeah, that's kind of like I made a very quick slides for us to go through. I'll take not more than 15, 20 minutes. And I'm gonna just kind of spark your questions about what happens. And Josh, you have already a question about when should we move this? When do you know? I also have this question: when do we tell someone that they're acting like they have a personality disorder? I think that's a question we get a lot. And I've noticed more and more, and I had this yesterday with a program where it's very clear that this person is acting and meeting criteria for one, and all they're saying is that they're not because it upsets them, right? So they're walking on eggshells with the diagnosis. So what is our role as clinicians and our role as consultants to really help those families? And are we doing them a favor or a disfavor when we attach personality disorders to a stigma and make it something that it may not be, right? So I'm just going to share with you, bear with me. It's not an AI made presentation, so it's not going to look as beautiful as a presentation made by AI, but I thought you guys deserve to have a regular, can you see it?
Yes.
Okay, perfect. So the reason we say we are working with parents with a personality disorder, or if they're acting like they have one, is that we've all been in that place where we may be acting like we have one too. We have been defensive, we've been reactive, we've been upset, we've done all kinds of things that we're like, oh, that was not good. But when you're dealing with someone in the most stressful time in their lives, which is when a child is struggling with a behavioral health condition, sometimes parents would say it was easier with a physical medical condition that they could see and understand than it is when they are struggling with a behavioral health mental condition. You're going to see a lot of things that you don't know where they're coming from, but we are the ones managing it, right? So we need to understand that. So, what to expect. And I'm going to tell you, oh, I think there is do you guys have an echo? Hold on a second. I have an echo right now. Hold on a second. Oh, I know what it is. It is recording the presentation and it is playing it back to me in my ear. So I don't want that to happen. So let me see if I can actually stop doing that. So yeah. Let me just try to share this again. What it's doing is, as I never had that happen, because it's recording, it's actually sharing my voice with me so I could hear myself. So you guys don't hear me talking because it's just actually repeating to me what I said. So it's going to kick your butt. So let's say that if you are going to involve yourself with a case where the parents are acting like that, it's definitely going to kick your butt. Would you guys agree that that's the experience we all have? It definitely does, right? And then it will stress you out for sure. So we already know when we meet a parent that parent is going to stress us out. And the funny thing is we all, most of the time, go into it thinking I can help the kid, right? And so that's a common event. You're all going to smile and say, I've been there, I've done that, that's how it is. I'm going to try to name the things that we may not really see the names for it. So then we recognize that in ourselves. It will contribute to your burnout. So if you add the number of families with a personality disorder, you remember them more than you remember anyone else, including your successful cases. you will actually add how many years of your life they probably removed from you a bit, you know, and you will remember them because 90% of your effort has gone to 10% of your clients, and 10% of the clients are likely to have had a family member, both the client and the parents have a personality disorder or disorderish presentation. They are not going to take your recommendations. They know more than you. For whatever reason, they are ed consultants, they are neurologists, they are psychiatrists, and they have never worked in the field sometimes. And if they work in the fields, they are ed consultants and they never place anyone. It's a very difficult challenge because part of that presentation makes you perceive that you know more because you know something. And then it's very hard to delegate and rely on someone else's opinion. You are going to be likely to be treatment resistant. And if your client and the parent has it, you're going to have a hard time with your placement and your recommendations. And they're likely to have worse treatment outcomes. I could show you the data is very clear. I did a very long training for OCD and personality disorders, which is a very big piece of refractory OCD cases, and nobody likes them because it's very challenging to treat. Because you have to push them into distress to do the exposures and all that. And I have to tell you, it is a very significant impact on the treatment. And they're going to act like they are the only ones. And it's not a song, it is true. You can have hundreds of patients or clients, 5, 10, and if you have one that is acting like that, in their minds, you work for them and for them only. You are a private consultant to one family. They're not covering all your hours pay-wise, they are covering all your hours with your brain power-wise, and they will push for that and push for that, right? And you will experience, I promise you, that you're going to give more time to those guys than you give to other people. So remember that when you're dealing with a family that have the behaviors of a personality disorder, you watch your time, and you're going to see that anytime that I can't finish a session, and then I go on and on and on. And one time I realized I gave double the amount, and I realized, oh my God, I didn't recognize this dad has such a personality presentation, and I missed it. But I recognized based, why so much more time? Like, why couldn't I stop where I was, right? The other part is you're going to feel drained. So your energy will feel drained. You're going to feel like you have like a vampire sucking your energy, and you feel like anxious and weird. And I remember one time many, many years ago, I was pregnant and I had this mom in my office, and the baby jumped so much. I still remember the feeling because he was stressing the poor baby because her presence was very difficult to manage in terms of my own emotions. Also, be ready because you're going to get a flip. All of you guys have experienced that. It is a terrible feeling, but we're all going to experience a flip. That means that out of nowhere, someone that was being nice and normal is going to tell you something you don't expect, and they're going to flip on you. So you need to be ready not to take that personally and expect that that could happen, right? So then you're also going to learn that, do you guys have experience that you are great? I love you. You're the best consultant ever. And all of a sudden, I hate you. You are a B word and you are terrible and you don't know your job and you're like harming my child. It goes from love to hate so fast. And also, anyone in the team has two positions. Either they are the most amazing people they've ever met. And one time, this patient came to the office and said to me, I just met you and I already miss you. Okay? I knew that was going to be ugly. And if you are new to this, you're going to be like, oh my God, I established the best rapport with this patient. I did not. I established the worst rapport with this patient because I triggered the idealization in her. And I know that the next breath, I'm going to be vilified. And that's what's happening to our team in general when we're dealing with multiple providers and multiple people, where the patient starts to split us on great and terrible, right? And the higher the pedestal, the bigger the fall. So that's going to be one of the things. When you feel the flip, when that happens, you're going to experience that emotion of like, I got hit. Yeah? And you're going to feel that you never gave enough. And I think that that's, to me, one of the most powerful understandings of managing people when they're presenting with PD is that they elicit feelings on us. And I've been trained in psychoanalysis, but I am a wholehearted CBT person. But in psychoanalysis, they call that the contra-transferential issues. Pay attention to how you feel when you are someone. I'm going to tell you, pay attention how you feel when you're someone that presents that way, because you're going to start to doubt your professional judgment. And I tell you that it's so clear that things that you know to be true, that you know what to do, you start saying, oh my God, maybe I missed this. Maybe my team missed this. What happened here? And you start the process of figuring out. One thing I'm going to say to you that is important to recognize is that you're going to have a higher liability. And that's why it's so important to learn and talk about this, because you will encounter families that actually turn the case on you. And I would say that if there was a study on claims and issues, legal issues against clinicians and consultants, a very large number of them would probably be based on the fact that someone is actually feeling some invalidation, abandonment, and all other things, right? So this is a patient of mine that said that to us. Hold on, it's playing again in my ear, whatever I'm saying. So this patient said this to me, and I felt that that was really interesting because it really tells you how they feel. And I think that that's really what I'm gonna try to focus with you guys on, is that although it's really hard to manage their presentation, it must be really hard for them to manage the way they feel all the time. And I want us to like understand that, right? And so here we are in the different areas. Yeah, and so I don't know if you can hear me.
You have to be aware of some
Can you hear me? Yeah,
things
it's just,
come up
it's just
and watch.
playing it again, which is very weird. And anyway, so we have to walk on eggshells, right? And we have to, and I'm gonna move on because those are the ones that are repeating in my head. But it is very important to understand that you know, your behavior towards this population changes very similarly to the parents' behaviors towards their kids. So a lot of times you will see a parent walking on eggshells, and you're gonna see yourself walking on eggshells. You're going to try to react a lot like the families that react towards the kids, and the things that we're telling them not to do, we may actually do it. And so I want you to today, and we're going to talk openly and then, you know, kind of debate a little bit on this ways to do this better for all of us. But what is so important that we understand here is that in terms of how to manage this, you're going to have to predict to prevent. And actually being able to look ahead and know that you're going to feel in a certain way, and those parents are going to probably behave in a certain way, allows you to predict those things and prevent. And this really, really makes a big difference in the way you are going to manage those families. And I'm going to start with really one skill, okay? You know how for DBT, you have a lot of skills that you teach the families and the clients. This is not a DBT skill, but is actually a skill that I've learned over the years that has really grounded a lot of the work that we do, because it gives us permission to actually bring things up when people feel like, oh, why are you saying that and what's happening, is that before we even start a relationship with a family, is that we want to ask permission to speak, meaning that, is it okay for me to bring up anything that I'm thinking? You know, do you think that there are some areas that you don't want me to address it with you? And if I know something, or if I notice something, is it okay for me to openly talk to you, you know, and we can discuss it and clarify things. And I've learned that, you know, and you guys could share your experiences as well, is that by doing that, when the parent's going to react to something you said, they remember that they gave you permission to say it. And that gives them more control. So a lot of those behaviors in personality disorder, I think, are connected with control, right? Don't throw something at me that my emotions are not ready to handle. And so asking the permission to speak is a good thing. And also how you speak. So in my mind, I realized that I made a lot of mistakes, by the way, over the past 30 some years talking to families. I had a lot of reactions. I have a lot of fan mail, a lot of people that do not like what I said or did, right? And I had to figure out that I don't want to compromise what I'm gonna say, because then I'm not treating you for your condition. I'm not helping you. So over the years, learning from trial and error, I realized that including myself on the conversation was helpful. So the language that I use with them is less like, you need to do this, you've done that. It's like, we need to work on this. This behavior is going to affect the system that you're in, right? And actually, by doing that, it allows them to reflect on themselves. If you try to point at them and ask them to reflect on what they're doing, why are you doing this? Why are we reacting this way? I would say 99.9% of the time, you're going to get a reaction back. But when you say, we together need to work on a different way to approach this issue, do you agree that we could do that together? And that language is really important, because it just minimizes the reaction and the rejection of what you're asking them to do. Also, this is a concept that I've created a few years ago, but I do believe in it. Is that you have to start depositing on the validation bank. I'm not a big validation person, because sometimes validation becomes, in our world, a compulsion in OCD. Like, you need to validate, and actually people feel invalidated. But I think that one good way to start is to validate someone for their experience when you meet them, saying, wow, this must be really hard. I can't imagine what you're going through. It must be super hard. And I'm going to tell you that a lot of things that I'm going to tell you in the future may feel to you invalidating. It may feel that I'm questioning how bad it is, or your emotion, or how difficult it is, the challenge. But by actually forecasting the feelings of invalidation, right? I'm depositing a little bit of validation in the bank without having to give validation 24/7. It diminishes my walking on eggshells interactions with the patient and the families. So I highly recommend that you create a validation bank. That doesn't mean you deposit the validation all the time. You do have a little bit of a savings account where you already validated the experience. You already forecast you're going to create situations that may invalidate that person. So I may say something to you that's going to feel highly invalidating. So I'm sorry it's going to feel that way. But in order for us to get there, we're going to have to get through that. Because if we stay on the validation of your feelings and go back to that, it becomes more about you. And we want to be more about what we need to do together. Okay. And so I find that actually is a very, very, very helpful tool to help manage those families. And I'm going to tell you something. Do you all have a contract when you work with a family for placement? Yes, right, Josh? Everybody here has a contract, right? It's funny, I have never seen a prevention of those issues in a contract. And it's funny, because I do think that there is a space for that. And then it's a space for how do we engage together. So there's a do's and don'ts in your contract. We all do this, but I won't do that. And if you ask me for this, I can't do it, but I could do this, right? So how about if we think about the core issues that you're going to see when you're working with someone that is difficult? And I'm going to say it, that has a PD, that behaves like IPD, or because it's stressed out, or because it's a difficult person. Could be any of that, right? Should we have a little bit of like a rule of engagement that we talk about together and say, working together as a team, those are the rules of the team. This is how we're going to work together, right? And I would like you to signal with your hands. Does anyone have that in your practice right now? Josh, tell us how you do it.
So in my placement contract, I have a section of the family's responsibilities and a section for my responsibilities. And in the family's responsibilities, if they engage in certain behaviors, the contract is terminated, and there's no refund. And those include things like unwillingness to engage in the readings and the um, assignments that are given. If they pull a kid out of a program against medical advice, immediately terminated, no refund.
Right.
Things of that nature. And then my responsibilities are also listed, and the things that I will do and the way I will provide information.
Right. What if they start splitting the team, like creating a split in your team between you and the placement and you and the psychiatrist? Is that in your contract that, their job is to unify and be part of the team and bring people together?
That is not in the contract.
And that's my question. And I think that that's the conversation I want to have with you guys is that, if we don't tell them that that's part of like teamwork, they have never been in this situation before, if you think about it, right? So a parent usually is with you either because they are there for the first time, or they had a bad interaction with a consultant before, or didn't never have a consultant, right? So those are the options. And they don't understand the engagement. And so our engagement is more upper level here, but the psychological pieces are not there. So for instance, what if they start auditing everything you do? Which they will, right? They will do that. What if they start to react very angrily? What if they kind of bypass you and go talk to the director of the program and not tell you? What if they get another consultant to work parallel to your work, which happens a lot of times, and you don't even know that there are two consultants working in the same case, right? So I'm just saying, yes, we can't prevent everything, but there are certain things that we deal with that really increase our stress, really. And those things that you mentioned, Josh, are more like non-compliance. But I'm talking about the undermining and the stress situations that they create and that actually affect the work, right? So what I want us to do is to look at the behaviors. What are those behaviors that we predict? Can we, maybe together, we could actually predict a bunch of them here. We know it's going to happen. They're going to audit you. They're going to split. They're going to get angry. They're going to idealize you and they're going to vilify you. All those things are going to happen. But what happened if you told them that beforehand, right? So I actually decided we had at a point so many parents at the same time. And I don't know why New York produces a lot of those guys. I don't know what it is in New York, man, in the water, but they produce a lot of that behavior, right? We had in the moment in our OCD anxiety program, a few of those guys all at the same time. And I decided to do a workshop on those behaviors. What it is to partner with our team. What is your partnership looks like? What are the things I predict could happen? And you know what's so funny? I got so many of the parents later on. It's like, were you talking about me? Were you talking about me? And I did call personality disorder. I said, those are emerging behaviors that could come from stress or from your life or from your history that are really conducive to questioning if you or someone in your family is acting like they have a personality disorder, right? Because I can't diagnose them because I'm not treating them, but I want them to raise the flag of like, wow, that's very PD. So every time that we do something, you work so hard on a case, and let's say someone forgot to give them a phone call at 3 o'clock and they call them at 4. That's all they're going to talk about is how come you didn't call me at 3 o'clock? Well, you spend probably 30 hours that week trying to do something for them, right? And so it's hard for you yourself not to feel invalidated for the work you did, right? And sometimes we start to get angry at them and we start to resent them. And we start to feel like, I don't want to work with this type of family. And so the goal of our conversation today is not to like typecast a family and say, oh yeah, that's a PD family, I don't work with them. It's to actually look at them and say, wow, that sucks, right? You already have this kid that is struggling so much. We know that one aspect of a personality issue is that they feel things, the emotional regulation, the experience is really loud. And so if they're experiencing, anyone who experiences a problem with their loved ones, know how terrible that feels. Imagine if you multiply that in loudness by like hundreds. So that person is experiencing something that you experienced and modulated and managed, And now like they're living stabbed to death, right? And so one way for us to look at it is look at it as a set of behaviors and not as like a like purposefully against you kind of a thing. If they're acting with you like that, you're not that special. They're acting everywhere like that. Sorry to say, you guys are special, but not that special. So they are acting everywhere like that. And that is actually a way to walk into that conversation to say, hey, I'm experiencing this. I'm wondering how your child and the other people in the team may be experiencing it, right? And a lot of times I say to them, I need to give you a crash course on how to interact with the team, because if you do A, B, C, and D, you're going to have a team against you. And if you change those behaviors, you actually unify the team to help your loved one, right? So that concept of unification has to become a value in your treatment with them. And if you are clear about that, we don't split, you unify. Anytime you hear splitting, you say, huh, so funny, I'm hearing some splitting here. How can we unify this concept? So Mary is not doing so well because she is not calling the blah, blah, blah. Okay, sounds good. So it's, let's unify this. What can we do together to support Mary? Because our job is to support Mary in doing a better job. As a parent, you are supporting the team and we are supporting you, right? So it's a very different mindset than looking at them as, I don't treat families like that, because otherwise none of us would have a job.
Can I say one thing?
Sure, 100%.
On your topic of splitting, we have an issue, I think that you won't face, but like parents are super, like a lot of parents get really suspicious of us and like our relationships with programs, and
Yes.
that we have the program, that we're friends with the program, or we have a relationship with the program. Like in my
Yes.
contract, I have in bold that I don't have any relationship with any program and I get nothing from a program, all that kind of
Yes.
thing. But I like at times where, like, to your point before about like sometimes we'll each get somebody who's been working with somebody else, another consultant, because that consultant did XYZ. 95% of the time I'll say, well, I probably would have done that too, or I can see why they did that, whatever.
Right.
But if we have in the contract that we can't get split from you, we look like we work too much, that we're not their advocate, which we're supposed to be. We're supposed to
Awesome.
tell them the truth, like you say, like,
Yes.
that I will always tell the truth to the family, but we have to be
Yes.
careful not to preemptively tell them we're going to side with you. That's all I'm saying.
Right. And so splitting and siding is different. And I think that's a great point that you're bringing, Steph, because the reality is that you can unify and disagree. And it can be both. And that's really what we tell our parents, that, I'm here, I'm your advocate. And the only way that I could advocate for you is if I have a united conversation with those folks and I sit at the table for you, for me, and for them. But that does not mean that we're going to agree with everything. And it does not mean that I'm not going to raise red flags. Actually, I will, and I have to, because my loyalty and my commitment is to you, not to anyone else, only to my client, right? And so I think it's important, it's very different than when they try to split. For instance, a lot of times they try to split you from the client. So the parents try to unify against you and they split. Or what they do is they unify with you to split against the client. Or they actually take the client and split against the program. And if you are working with the program, they split against you, or they try to split you from the program, right? And I think having those understandings of like, what does that mean then? Can I actually tell them, listen, we have to work together? That means that, well, I've been working with Dr. Hoffman for, I don't know, 30 some years, and we disagree more at times than we agree at times. And we use that as a richness to the work, because if we have two different points of view, we can see things more, into a bigger spectrum and understand that there are different ways to go about it. And we both could be right about it in different ways, right? So when we're working with a family that feels that way, if we reinforce that feeling of like, oh, no, I'm not working, I'm with you and not with the program, that may reinforce the inability of the program to clarify what they need to do. So I think clarifying what they're feeling is important. Wow, why are you thinking this way? And actually teaching them to ask you clarifying questions. In families with a PD, I also always find that if they are giving the opportunity to clarify some things, they are actually, oh, wow, I didn't understand that. I actually thought it was different, right? And so I would actually prime them with the idea of clarification, that yes, we need to clarify. Yes is a good idea. And if you feel in any way, because I already validated you before, I said, yes, you're going to feel this way. You're going to feel something is wrong. You're going to feel like I'm doing something wrong. Please bring it up so we can clarify this together. So that relationship is the same for the consultant and the family, the consultant and the program. So for instance, with us, sometimes, we work with consultants that are very easy and clear with us. And there are people that we like, oh my God, I don't want to hear about this case because I'm afraid of the consultant, because this is going to be a little bit of a hectic moment, right? Because we know that there's going to be misunderstandings a lot. So our job is to say, wait a second, let's clarify this. This is what I do. This is how I do it, right? And so it's very important that the family sees, because if we engage in the splitting, then what we're doing is we're taking away the opportunity to clarify, fix the problems, and build together. And I think that's really the concept here, is we're building something together. And there's nobody against anyone. We have to all be in the same direction. So the program, even when the program, you guys are very skilled consultants, you're not putting someone in a program that you think is the wrong program. So you thought was right for a reason. Maybe it's not working out. Maybe we need to switch. There's so many things, but clarifying why is really important, right? So can you guys share maybe a situation where working with a family, you guys were able to turn it around with one of the skills that I mentioned, just as an example? I could give you a bunch, but I would love to hear from your examples.
Maybe my
Anyone?
current,
Yeah,
maybe
go
my
ahead.
current case. I don't know if we turned it around yet. I'll let you guys decide.
There are parent cases that we're like, you have to turn it around. So the parents react and they become very protective, and then they see what the good you're doing, but then they have to make it bad to justify their behaviors, right? And so
I mean,
you have to accept it.
they're like splitting, fanatics. I mean, they have
Yeah.
split every program, and I keep saying I'm running around like a lunatic, trying not to let them split here. That's what
Yes.
I'm always saying. Let me get on the phone with you. Go ahead. John wants to say something.
Yeah, no, I didn't mean to interrupt you, but go ahead. But I do have something to say. But Stephanie, please continue.
No, I'm just basically saying that
Yeah.
family, you and I have been talking about it like every day this week, basically, how
Right.
every program they've been to hasn't done XYZ. They don't ever understand what the program is saying, and I think some of the programs haven't been strong enough to hold them, and that's the thing. I just got off the phone with a mom whose older child was with you guys, and she wants to hire me for her second child. And I did not know that the older child was with you. So the entire time I'm going, this kid needs to go to NBI, this kid needs to go to NBI, this kid needs to go to NBI. So at the end of the call, she goes, well, my daughter went to NBI. And I'm like, okay, so then what are we talking about? Like, that's what you really should be doing here. And she gave me the problems. And I'm like, you gotta I tried to explain to her like how she's sort of imagining, but she went through a whole litany of prior programs in your program. And so I just feel like it's a lot of work to get people to understand, but you gotta I think getting on the phone together is a big way of doing it. That's like what I always try to do. Let's get on a call together.
Yeah, so you unifying, right?
Yeah.
I work with a lot of people and families where someone's on the spectrum, among other things that I do. And one of the things we know about family, with people have OCD and ASD, or it's in the family, is that we might be anticipating that someone has a skill set or understanding that they don't actually have. So we need to treat that first. Sometimes before we treat OCD, we have to make sure they understand what treatment is or not taking it literally. And I think that the same things with families that behave in this way, that sometimes, and as Katja will tell you, I'm very fond, I probably drive her crazy with this, of Punnett squares, because I think if you could put something in a Punnett square, like an experiment, then you tend to understand it. And if you can't, it tends to not be very, very clear. But I think there's a difference between positive challenging and negative challenging. And I find that a lot of the families I work with, they don't know the diff. They just think of challenging. They think of that challenging per se is good, and they're not thinking of, well, this is a way to productively challenge. So I just find that providing some education about what productively challenge, if I notice that the people are doing that, I would have a conversation with them and help them differentiate the challenging that helps things move forward, and as Katja said, unifies and brings them what they want, and the challenging that takes them further from their goal. And once they can reliably do that, and I make it like almost like a hierarchy of a relationship, a treatment therapy, a treatment threatening behavior, that until we understand that, it's very hard to go into the next step. So I just thought I'd throw that out there. But I think
Yeah.
sometimes just giving someone a very simple rubric about how to understand things helps them box score things in certain ways.
One of the things that I do when I'm working with my clients is I'll explain that my allegiance or the work I'm doing is in their child's best interest. And I'll explicitly say it doesn't mean it's in your best interest, or it doesn't mean it's, it's what you want. So I might make recommendations geographically that you disagree with, but it's because it's in your child's best interest. And they always say, yeah, we understand. And then, they
But give
see
us a
Utah and they
closer
cry.
place.
What's that?
But give us a closer place.
Right, exactly. They'll be like, but Utah, like, yeah, that's,
Well, it's really give us something that doesn't exist. And
That's
Right.
that's a
Yeah, and I
problem.
think, Hannah, you bring up that for you, like when someone tried 4 or 5 programs and they say they're all disasters and they're not gonna work, right? It's a red flag to you that something is there, like shopping, and is not working.
Yeah.
or they've had 4 or 5 consultants.
Yeah. I just, on
Mm.
your earlier point, Katja, I actually have in my contract, certain contracts, not always,
Uh-huh.
especially if I ever do anything hourly, I explicitly have in the contract, you cannot have 2 consultants. You can't,
Right.
you
Right,
cannot.
and it's
we
very
won't.
confusing. Yeah, I think we all experience that, where we think that there's only one consultant, and then we find out there are 2, 3 sometimes, and it becomes like an issue because we work with all our consultants. We have a direct connection, and all of a sudden I let them know, hey, I've met someone that's saying that they're consulting the case I didn't know. So I thought you were the consultant, right? I think that happened to one of you lately, where like, wait, who is the what
Well,
is this person
every
doing?
once in a while, you find out someone has, and this has happened with families I work with, that someone has another family. Someone has another, or this happens to us with telehealth sometimes. Someone's on the call and we don't know they're on the call.
Oh, yeah, that's
These kinds of things are
the
just
parent is always hiding in the room or outside the
Right.
door.
Wait,
doing-
I just had this terrible situation where the sibling was in the car listening to 100% of
Oof.
everything. And I was like, wait, no, but I told you not to. This is not okay. And that's really, really upsetting, right? But I think that the reality is also, I want to talk to you guys about yourselves, and also how to create a space where you watch for those feelings, pitfalls, and difficulties we have, because we are in this world of, we take it, we'll go, we go, we go, we go. And then we keep just like piling on, and then eventually we feel like, wow, I'm just burned out, exhausted. And I could actually name the cases in 30 years of my career that the parents had. Like, I remember them like today. I remember what they said and what made me feel this way. Remember, it's like what to say, it's not what you say, but how you make someone feel. And sometimes families that have a personality disorder, or like type of strong personalities, whatever we want to call them, right? I'm not going to call them New Yorkers, as I joked before, but a lot of them could be coming from New York.
Yeah, be careful with that.
I know, I'm not calling that. But it is how you feel. And I think that knowing that this feeling is coming from their challenges and not from something they're trying to do against you, right? It is really a way to go around it and help them. I do think that, we could consider an onboarding process for the parent that has a piece of that, right? So we noticed that for us, it helps a lot in our, focusing on parenting and family the way we do, right? That actually having this conversation before anything happens helps you just connect the dots right away. And so I said, oh, I'm seeing that stuff that I told you where you're going to start stressing. I noticed that there's an auditing here. We've done this work together, and now you're pulling the things that have not worked. And I know that they're important. And boy, they're good at auditing. I really think that we could give them an auditing job at a big company and they'll find the mistakes, because it's incredible. Like sometimes I look at it as like, oh my God, I really need a consultant then, because I really need someone auditing this, right? But I think it's really to recognize how they make us feel and use that a little bit of a gauge of, first of all, managing it differently, protecting ourselves, right? Because the work we do, we don't think it's gonna get us, but it does. I think that all of us here will agree that eventually it does get us. And for the younger consultants, from the older consultants, we all have been in a moment, and clinicians, where we're like, wow, I'm like, what do I have in me? I don't have much in me right now, right? And so I think that the understanding that we must have a conversation, protect ourselves, and take this a little bit more like a focus, because if you're going to look at what really hurts the most here in our day-to-day is when you take a case and that's the situation. And some of us are so used to it that we are desensitized to it, and every time that you see a new case, you're like, oh no, this one is not going to be so bad. I know I could turn them around. I just need to have a little more patience and explain this and that. And you're not wrong, but we have to become better at doing it. And we actually say to them all the time, you need to set boundaries, right? We talk so much about boundaries with our families. Do you realize that those guys push our boundaries so much? And a lot of times we don't know how to set it. And so I'm going to say, in the office, we call it drop the mic, a lot of times I say to the team, drop the mic, say, listen, I don't think this is going to work. And you guys know what happens when you say that's not going to work and I don't want you to be here. It's going to be like, ooh, that's going to please. Now I'm going to be so good. Now it's going to work, right? And I think to be careful about that as well. So, okay, if it's going to work, here are the rules. But my question is that what if we establish these rules from the beginning and actually connect the dots as they go? Are we going to diminish the burnout for us and the difficulties for the case? And I think the answer is yes, right? So I'll tell you that the times where we really mindfully said, I am going to prepare my people. I'm going to prime this family. And those are the things that I'm going to see. And sometimes they're so sweet and you don't even notice until the flip comes. Have you ever experienced that? You're working with this family and you think it's great. And all of a sudden, out of nowhere, they literally turn on you and flip on you so bad that you're like, whoa, what just happened? Right? Those are even scarier because you feel like you are totally caught off guard.
I found myself in exactly the opposite situation recently, where the parents have been so on board and so functional in what they're doing and how they're approaching things from my perspective, from the program's perspective, from the therapist's perspective. And I kept waiting for the other shoe to drop. When is this going to flip into, where's the personality disorder going to show? And the fact is, it's not. And I don't want to put myself in a position where the expectation is negative.
Absolutely.
So to be aware that that was my thought process, I probably could have produced it myself. Luckily, I didn't. And so it maintains the positive trajectory.
Yeah, or Josh, maybe also by predicting that I think, we can't predict that every family is going to flip on us, right? So something about that family gave you a small perception of that because you don't have that with every family, right? And maybe, the stars lined up and nothing really terrible happened and there was no challenges that were so big that they triggered them. But also perhaps by thinking that you felt something, you have made some adjustments to the interaction that make clear to them that that's not going to be a good way for us to go work. And because the work was going so well, they didn't want to mess this up. So I want to give you credit because perhaps without even, noticing that you did something, you may have adjusted some of your behaviors that really prevented it from the flip, right? Or for something in the future. Lucy, do you have something? Because a microphone is up. I think you had a thought.
No, I'm just thinking about a family I just started working with yesterday, and I don't know if I. It's almost the opposite of what Josh is saying, where it is so apparent, right? Like my guess is mom is borderline and dad is narcissistic, and they're divorced, and all they do is fight. And I tried to set it up, and I thought I was being nice. I said, "Do you require separate, calls?" And we did the initial. Yes, we do. And then I turn on my screen, and they're both there. I said, "Oh, okay, so that changed a little." Well, we thought we'd give it a try. And like, then the mom's yelling, "I see your wife in the picture. Get her out of there." And the wife is like, "I'm sorry, I will leave. I didn't know it was going to bother you. Of course you knew it was going to bother me. They do this all the time." Like, and then start talking to me about him. And then he tells me she's trying to make it sound like I'm horrible. And I mean, I think what was exhausting, I know it's happening. And so I'm constantly trying to set boundaries with them. And that's exhausting.
I think it's sometimes prediction is important, but to go with what Josh was saying, it's sometimes just being prepared and knowing that a lot of this is out of our control. We can make errors in over predicting and under predicting, but just whatever happens, that we have the adaptive skills without judgment and with a neutral attitude to try to be ready with our skills. Well, however we see that the important skills to impart then is that, oh, glad you brought that up. And let's talk and be, prepared rather than having like a priori, like, projection. I think spending some time in preparation, because any case can go any which way, because the variables, as we all know,
Right.
are impossible to predict. People we think will never do well. People we think are shoo-ins, are disasters. It's hard to know.
Right.
Yeah.
I'll say, Lucy, one thing that I do sometimes when I see a situation like that, I create a challenge for the parents. Like I actually create a challenge. Those people that are in this very conflictual separations and new lives and wives and everything, they have no direction. Only direction is crashing against each other. So I try to create a challenge that is for both parents to like meet together. And that really brings for the first time in their lives something that they have in common, which is this challenge. They have a child that is struggling, and what they do is that actually creates more of a conflict. They go face to face on the conflict. I'm trying to turn them this way. And when I turn them this way, it allows them to say, we are like that for everything else, but not for what Lucy is asking me to do. And I'm going to show you guys, anytime that you turn this way, I'm going to stop. I'm going to say, none of this is allowed in this conversation because it's not going in that direction. So it's almost like if you were running, today I just came from an exposure that was insane, by the way, guys. We just did a crazy thing today. But so if you're running an ultra marathon, right? I mean, you're running an ultra marathon, and someone is going off the course of the marathon, and you're saying to them, no, you're gonna stay on this marathon. And they together know that it's an ultra. They know together this is gonna be hard. So you're gonna know this is the hardest thing I'm gonna ask you to do. And my job is going to be is to turn you in the right direction of where we're going. I'm going to say nothing but like we're going this way, right? And you guys are going to have a little bit of blind faith that I'm taking you on the course and not taking you off the course, right?
That's helpful. Yeah.
Yeah. And I find that conversation with one's spouse that is feeling like your new wife and everything, say, are you going back to this husband at all? Like, do you have a plan of like breaking up their marriage and going back to the guy? And they say, God forbid, he's they will say terrible things. So in our team, the more people are cheering the other person on this ultra marathon, they're not running with us, but they're cheering. If there's anyone in your lives that could cheer us on, please enlist them in cheering. And so you're turning them this way again to this way, right? Yeah. So that to me is a helpful skill when working with broken challenging, and I call broken because they're not broken because they're divorced. They're broken because they're killing each other, right? They're
Correct.
breaking each other up. And so if I turn them into a mission and a challenge, and they know it's going to be difficult, and they know that they're going to try to get off course, and we're going to say that absolutely not allowed, right? They start competing to do better in that challenge. And remember, if they're trying to do better in the challenge, they're behaving better, because you're going to say today, so and so did a great job in our challenge, and the other one's like, what about me? Because they're narcissists, right? What about me? All right, let's see you next time, maybe you do, and so keep on pushing them in the direction that you want. And I think a consultant, and that's why we love working with you guys, is that because that consultant is that guiding force. We give the skills, you guys give direction, right? So if you're going to send them to a program, I'm not sending them to the program, you're giving them direction. So I'm supposed to give them the skills to go to the program, or when they get to a program, or wherever they're going to go next, right? I'm supposed to give the skills. But if you're giving the direction, make that for them a clear understanding that you're pulling me off course. I'm not going to let you do it. I'm not going the right direction if you do this. And so maybe that will be one of those pre-made, kind of contracts. If you guys are families that are like to fight, that like to do this, I'm going to give you a cheat sheet of how to stay on course. And this is what you do.
Okay.
And keep them on, because your direction is going to, they're gonna hear you, and they're gonna decide whether they're gonna be part of the problem or the solution, right?
Yeah, and I'm, one thing I keep stopping myself from saying to them is, until you love this kid more than you hate each other, we're gonna get nowhere.
Mm-hmm.
But I don't have the rapport with them, and I don't think it's going to turn out well if I say that. But hearing you
Yeah,
talk, I wonder if I say it differently. I know you both love this kid more than you hate each other.
absolutely.
Let's get back on track.
And all we're gonna do moving forward is I'm gonna help you act like that. I don't care what the thoughts are, and I don't care how you feel. Sorry.
Right. Not
Validating
about
that is
you.
bad, but
Right.
it's I'm validating is terrible. Whatever's happening is terrible. But moving forward, I'm gonna hold you to your actions, and you are going to act moving forward like you love this kid more than you hate yourselves. Maybe more than your situation aggravates you, right? And so if the situation aggravates you, I'm gonna turn you towards the goal to love your kid and help your kid, right? I guess sometimes if we use more direct language that is more behavioral, they can actually guide themselves better, because emotions are like, oh, but I love my child more than life itself.
Right.
Well, I'm going to ask you to act on those, act on the behaviors, right? So I think that that's going to be helpful. I may have questions here,
I
but
have to run. Thank you for
yes,
everything.
we actually got booked for now, but next time we have more time together. And if you have questions, you guys have our cell, call us, ask any questions you may have, okay?